Day today. This morning I started my day as I always do with facelifts and breast reductions and tummy tucks and all those sort of things. So now we're seeing consults for upcoming surgery, and we just saw some really interesting patients who lost a lot of weight. So we do tummy tucks and breast lifts and facelifts on them. And a bunch of questions have come in throughout the day. So let's hit some of the top 5 questions of the day. Number 1 was a facelift question. It asked me what the downtime with a facelift is. First of all, as you guys know from watching me, I really like a very natural look. So when I do a facelift, we make the incision. Those incisions tend to heal very nicely. It allows me to pull not only the skin, but the deeper muscular levels. And the question that came in today, does the neck get fixed when you do a facelift? And absolutely. The face and the neck are one structure. So when I pull up the neck, I pull up the face, or vice versa. So that's question number 1. Facelifts take care of the neck. In-office procedure, downtime about a week of swelling in black and blue. Tons of guys doing it, tons of women doing it. I often will combine other procedures along with my facelifts, like a laser procedure for the skin, upper and lower eyelid lifts. Sometimes I do fat injections. All about natural rejuvenation of the face, looking great. And another question came in about a facelift. So this is question number 2, hot topics of the day. And that is, what age should I do my facelift? And it's any age. It depends upon anatomy and not age. I've done 90-year-olds. I've also done 40-year-olds. It really just depends how you're aging, what you look like. Part of that same question, by the way, was should I do my eyes along with the face? Great combination to do both the eyes and face at the same time. Works well together to do that. So rejuvenating the eyes and rejuvenating the face at the same time is a great combination. Okay, question 3, hot topics of the day. When you lose weight, this comes from a massive weight loss patients, can I do the belly at the same time as doing the breasts? Awesome combination. I do the body makeover, the massive weight loss makeover, or the mommy makeover, combining breasts along with belly, both for men and for women. So if you're losing that weight, you're on Ozempic or Zepbound or one of those products, or just lost it on your own, we can then go ahead and lift the breast, sometimes implant, sometimes no, or we can reduce the breast and do a tummy tuck. So that was question number 3 of the day. Question number 4 of the day is, how do you treat cellulite? Well, cellulite is indentations of the skin. We have special lasers. We have something called Avali, which is great for the butt to get rid of those dents on the butt. And there's a new compound that I'm using, which is fat that's made in the laboratory called Alliclay. It's awesome. This is great for indentations of like the butt. If you want to make the butt bigger, it's great for indentations of the hip dips. Alliclay, great new substance. You come in, we don't have to do liposuction with it, and we can do that fat transfer. It's fat basically made in the laboratory. And what we do is we put that into the butt or the hip dips without having to do lipo. It's an in-office, quick injection, takes 5-10 minutes to do, and you can get that butt that you've always dreamed of. Last question of the day has to do with breast augmentation and breast lift. And the question is, do you always have to put an implant in when you do a lift? Nope. Sometimes I do a lift alone, sometimes I do an implant alone, and sometimes